Hello and welcome to another edition of Facebook Live. We are talking all throughout the month of October. Of course, we're talking so much about breast cancer awareness, breast cancer screening, and that's what we're doing today. We have a really interesting topic, especially when it comes to hereditary cancers. Meghan Burgess is an APRN, a nurse practitioner, who specializes in testing and helping folks sort of through what does this test mean, what can we learn from it. So it's so interesting, and as you had just done an interesting interview, we thought we want to take advantage of this moment, chat with you a little bit, and then share with folks what you can learn from these tests and why it's important to do it.
Sure.
So tell us a little bit, what is hereditary risk assessment, just like from the get-go? What's that process?
Yeah, so when we identify people that may be at increased risk for certain types of cancer, we follow some guidelines. So what we look at are early onset cancers, rare cancers, multiple cancers in families that we worry that there's a genetic link, that these aren't sporadic type cancers, that there's more to it.
So are you looking at people's history when you do
Their
this?
family history.
All right. So even from personal experience, you had us taking a questionnaire.
Yes.
All right. And then what do you glean from that questionnaire? I remember looking at it, I had to answer about my family history, who may or may not have had cancers.
Right.
And then when you say if I circle a yes or a no, tell me a little about that.
Right, so that questionnaire was based on national guidelines. So there are certain criteria that need to be met, and even in order to even talk about genetic testing. So not everyone's appropriate. Most cancer in general is not hereditary or genetic. Most is sporadic, but there are certain instances, and so that questionnaire was formulated based on those guidelines. So for example, circling yes to a family member diagnosed with breast cancer under age 50. When we talk about family, we talk about mother and father side. They're equally important when we talk about risk, so that's something that's important. Also first, second, and third degree relatives. So we want to take a full comprehensive family history in order to get the full picture. Another yes would be male breast cancer in the family, colon or uterine cancer under the age of 64, pancreatic cancer at any age, ovarian cancer at any age. These are things that you may have circled yes to. Most patients will circle no, but we do know about 25% of the time people will be appropriate for genetic testing.
And then that's a red flag that
Yes.
says, you know what, maybe we should do a little bit more.
Right.
What was really interesting, and again, if you are out there and you have some questions, it's a great opportunity to, if you want to write them in, we can get them to Meghan right now. But when I was talking to you, I was really interested in this idea that if people think, oh, invasive tests. Not anymore. Now you can do it with saliva.
Yes, that's correct. So blood sampling is still available if someone prefers to have their blood drawn, but we are able to get enough DNA through a saliva sample. So we do try to keep it as simple as possible and not scary for folks. And people are busy, so the other opportunity and what sets us apart is after your mammogram, it's really part of your breast health. So identifying that you're at increased risk, giving you the education, the information, and then you making that decision for that next step and wanting to do that testing. And then it's, again, a saliva sample.
Are people afraid to take the test, or do you find that, by the time they're there to get a mammogram anyway, so they're obviously taking those steps to learn more and prevent?
Right. I think a lot of people are scared, and I think those same people that are scared of the genetic test results don't put it in that perspective that they're actually at the mammogram to screen for cancer. So more likely than not, they won't have a cancer come from that mammogram, but they are in fact there to see if there is any cancer present. So we have a captive audience, and I think the education piece is important, the counseling piece. So to decrease that fear, and again, most of those patients are already nervous because of their family history. So this actually can decrease their anxiety by getting the results of the genetic test and to make steps for them specifically to lower their risk or screen differently or more effectively for cancer.
All right, pretty fascinating. Now, so people then they go in, they do the saliva test, and then 6 weeks later, you take them through, this is what it means.
Right. Yep. So again, along with the pre-test counseling, the post-test counseling is very important because just getting a negative genetic test result doesn't mean you won't develop cancer.
Right.
So that's very important, and I go over now that we know these results, what are your risks of, for example, breast cancer, even though your test is negative? What should you be doing for your screening for breast cancer, for cervical cancer, colon cancer, skin cancer? Those are still important. Lifestyle modification. And then, if someone is positive for a genetic mutation, what does that mean for them? What does that mean for their family members? And then as a nurse practitioner, I can coordinate their care to all those different specialists.
Super helpful. Now, you had said when we were talking that there is a personal reason that you got involved in
Well,
this.
my background is actually 20 years of oncology nursing and a nurse practitioner, so I oftentimes had to tell someone they had cancer or they had a cancer that there was nothing else that could be done about it. Now, I've been doing genetic testing for about 10 years, and I finally made the decision to go on the preventative side, because honestly, I'm kind of sick of telling patients or seeing families that this cancer could have been prevented. Had you known, had you had genetic testing and identified this mutation, we wouldn't be having the conversation about the cancer. So now I'm on the other side of oncology or cancer care, and we're on the preventative side, so we know we can prevent these cancers from ever occurring, or if they do occur, they're diagnosed at the very earliest stage when they're the most curable.
Absolutely,
So,
and that is great advice.
Yeah.
Go get those mammograms.
Yep,
That
sure.
is so very important. Before I leave, because we have gotten a couple of questions about this, insurance is really moving into a direction that they're
Yes.
paying more and more for this.
Yep.
So people are a little afraid, oh, how much will I be
Right.
paying out of pocket?
Sure.
But the answer is more and more, less and less.
Yes. So as I mentioned, I've been doing this for over 10 years, and I will see the guidelines have expanded to include more individuals.
Great.
And as far as the coverage, it's gotten more generous, essentially. So most patients don't pay anything out of pocket. You have to meet criteria in order to have testing. So that's national guidelines, those are insurance guidelines. As long as you meet national guidelines criteria, then insurance will cover the cost of the testing. So in general, most patients pay $0 out of pocket, and so that's the best case scenario, because again, the insurance companies understand that although these tests are pricey, it's cheaper than treating cancer, and they'll then pay for MRIs, that a woman wouldn't ordinarily need, but now her risk is such that she needs that. These preventative surgeries, including reconstruction. So all that is part of the patient's care.
All right.
Yeah.
Meghan Burgess, we really appreciate your time. Thank you so much. This has been another episode of Facebook Live.
How old do you have to be to get
Oh, are we waiting?
Sylvia asked.
Okay.
How old?
Sylvia, you have a question that we definitely want to answer. So before we leave, how old do you have to be? So that really depends on your history, correct?
It really depends on history. So, depending on also if there's a mutation identified in the family, that would have different guidelines. But certainly when we know there's going to be an actionable, something we're going to change as far as medical management, then we can start as early as 18.
Wow.
Some syndromes, we wouldn't do anything different till 25, so then, testing would be appropriate beginning at 25. But I encourage you, speak to the provider and ask, depending on what the situation is, what the family history is.
Interesting. That was a question from Sylvia. Before we head out, Nick, do we have any other questions? No other questions. All right. Thank you so much. If you do have questions, you know where to go. There is a phone number, and you can certainly reach out to 855-HHC here. Thanks so much for joining us.